In this video, let's clearly understand how to code suspected conditions in outpatient and inpatient settings. This is a very important topic because the rules are completely different in OP and IP, and many students make mistakes here in exams. These are all the terms that indicate a suspected condition, like suspected, possible, probable, maybe, likely, questionable, rule out, or even a question mark. Whenever you see these words, you should immediately understand that the condition is not confirmed yet. OP section. In outpatient coding, the rule is very strict. We should not code any suspected condition. Only confirmed diagnoses should be coded. If nothing is confirmed, then we code only the signs and symptoms. For example, if the diagnosis is possible pneumonia, it means pneumonia is not confirmed, so we should not code pneumonia. Instead, we code the symptoms like cough and fever. So always remember, in outpatient, if there is no confirmation, there is no disease code. Only symptoms should be coded. IP section. Now let's come to inpatient coding. Here, we are allowed to code suspected conditions, but only if they are documented at the time of discharge. This is very important. For example, if the diagnosis at discharge is possible pneumonia, even though it is not confirmed, we can still code pneumonia as J18.9 because inpatient coding allows us to use the most likely diagnosis. One important point, this should be the final discharge diagnosis. If it is only an initial impression, we should not code it. Now, very important, exceptions. Even in inpatient coding, for certain conditions like HIV, Zika virus, COVID, and influenza, we should not code them if they are only suspected. These conditions require confirmation. For example, if the diagnosis is suspected COVID, even in inpatient, we should not code COVID because it is an exception and requires confirmation. So instead, we code only the symptoms like cough and fever. To summarize, in outpatient, we code only symptoms if the condition is not confirmed. In inpatient, we can code suspected conditions if they are documented at discharge. So the final logic is outpatient needs confirmation, inpatient allows the best possible diagnosis, but exceptions always need confirmation. A simple way to remember, outpatient means wait for proof. Inpatient means use the best possible diagnosis.
Follow for more coding concepts.